Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland. Soggy sheets and pajamas and an embarrassed child. It's a familiar scene in many homes, and bedwetting is probably something every child experiences. And here to talk more about this topic is Dr. Christopher Gran. He's a board-certified urologist at Fairmont Medical Center, Mayo Health System. Thanks, Dr. Gran, for joining us today on Speaking of Health.
Thanks for having me. Pleasure to be here.
Well, potty training for kids, it can many times be a challenge for parents, and often there are some bumps in the road to being completely toilet trained for children, aren't there?
Yes, and I think every parent or child that comes in asks about what's normal, and the answer is that every child is different, and hopefully we can address a few of those questions today.
Well, I guess probably a real common question that you get is, number one, when do I start potty training my child? And number two, when should my child be fully potty trained?
I think every parent brings their own experience with that, and usually they rely upon their own family and their own experience and their mother and whatnot. I don't think there's a proper answer in terms of when potty training necessarily has to start, and I think each parent and child is going to be comfortable at different stages. Every child develops at their own stage, and I think the child will start to give you some hints just by mimicry, recognition of what else is going on around them, and as you start to see them dry during the day and asking for that kind of assistance, oftentimes that the child will give you a fair bit of guidance on that.
Is there a target age where a child should probably be potty trained?
Certainly by about age 2.5 or 3, most children are going to be dry during the day and won't have any problems with the bowels either during the day or the night. The last thing that will typically come along and be the last thing to resolve, and what I think we're going to talk about primarily is the nighttime wetness, bladder control at night.
You think your child is potty trained but is still wetting the bed at night. As a parent, should you be concerned?
It really depends upon a couple of factors. Certainly at the age of at the age of 5, 6, or 7, it's really not that uncommon. Problems at night with wetness at the age of 7 still will occur at about 15%. And there tends to be a resolution rate of about 15% of each of those children that are still wet with each year that passes by. Everyone will follow a different pattern. I think oftentimes some of the concern comes from a child that is initially dry at night and then will have some relapses with wetness at night. And oftentimes it's completely normal. But if there's a concern for another condition, concern for an infection, pain that goes along with that, blood, things that just don't seem right, then I think evaluation at an earlier age and some concern is warranted.
For most of these kids, as they're developing, is the bedwetting mainly at night, and why is that?
Most of the wetness is going to be at night. Certainly there are children that are wet during the day. Some will have problems both during day and night. If there are questions, that is the kind of thing that we evaluate with some very simple questions. Most of the time, we'll gain enough information from just a history, talking with the parent and the child, that patterns that may be contributing to that are not really a medical concern per se, not a disease that we think is going on, but perhaps some environmental or behavioral impact that we can coach the family on and make some big improvements rather easily. So the history and a limited physical usually gives us an awful lot of information.
So what can cause bedwetting?
There are a number of different factors. We certainly see it running in families. Boys are a bit more predisposed than girls for various reasons. Oftentimes it's just the child that tends to be a very heavy sleeper. They're just not waking up. There are other things that can be related to either problems with emptying the bladder or problems with storing in the bladder. And sometimes those have underlying issues, and sometimes they're environmental and behavioral, and things that we can address with changes in diet and just patterns of behavior.
How does the body work? How does the body know when it's time to go to the bathroom, and does that develop in kids differently as they age?
The spinal column continues to develop from the time you're born until the mid-teens, sometimes a little bit longer, and it is different for everyone. There's a genetic component. Who your parents are has an important impact on things. If the parents of a family have had some trouble with wetting, the risk or the predominance in their children goes up. If it's one parent, it goes up by a little bit. If it's both parents, it goes up by a fair bit. And like anything related to health, usually it's not as simple as just one single thing. Sometimes it's genetic as well as the environmental patterns that go along with it.
So you talked about the spinal column. So I guess I don't understand the correlation. What does the spinal column have to do with wetting the bed?
The development of the spinal column, as well as the interaction that the spinal column and the nerves that go from the spinal column to the bladder provide a feedback loop and the information to the brain that prompt both storage when the bladder's filling up as well as emptying. So anything that has an impact, either a delay or an irregularity in the spinal column or certain parts of the brain, can have an impact on the development of the child as well as the timing of getting dry. One of the things that we get concerned about with incontinence that perhaps does not resolve or does not respond to various therapies, or in the process of evaluating it doesn't seem to add up, would be a neurologic condition. The vast majority of children that are wet are not going to have that neurologic condition. Just like we see problems with incontinence in older people, sometimes, not very often, it's related to neurologic disease because of the relationship between the spinal column, certain parts of the brain.
So as a parent, my child is still wetting the bed and is at an age where probably he or she should be pretty full potty trained. When is there a certain point when you should go see your doctor?
The general recommendation is if there are still more than a couple of wet episodes a week in a 6 or 7-year-old, right in that range, that evaluation be considered. Earlier, if there's something else going on, like a pattern of urinary tract infections, which will usually get you to see the urologist earlier anyways, but around that age of 6 or 7.
So what treatments are available?
Treatments start, as I said, oftentimes just with a thorough history and physical, identifying environmental factors, things that can be done that often can help move the child towards more dry nights and resolution. And then after that, there are various both mechanical devices, urinary alarms, which do have some success, and there are some medical therapies, different medications that usually are used for short periods of time.
And urinary alarms, what are those?
Well, the alarms help the child realize when they are wetting and wake the child up. Oftentimes, it's not 100% successful, but the success rates with that are pretty good, and usually it's something that's used on a rather short-term basis. There are various opinions on this, and the question is always, do the medications, do the alarms, do these other things make a huge difference, or is it simply that in the process of evaluation, changing some of the behavioral things that the child and the family does, and then the time that is involved, would that child naturally progress to being dry? It's hard to say. I think a lot of times the child as well as the family will feel better that there's a bit of pursuit that you're doing something rather than going to the doctor and having him say, well, if we give this 6 months or 12 months, why don't you come back? And if it's better, then everything will be okay. And it may actually be the case that that was all that was needed, was a bit of patience. But patience is sometimes hard to have in that situation.
Now, you talked about behavioral changes. Give me some examples of some of the things that you can do as a parent to help your child along.
Oftentimes there's a component, or one of the contributing factors is some dysfunctional voiding. Some children have problems with constipation. Some children have a pattern of going to the bathroom infrequently. Sometimes it's simple as reminding the child to empty out before bedtime. Sometimes we'll have children that perhaps are taking in the wrong fluids or the wrong amounts of fluids, particularly late in the day. And that, with simple changes, can contribute to getting them to empty out better before bedtime and probably making less urine at night so that they're not filling up. There are some other bladder training techniques that will also help with storage that we work on as well.
So some last words of wisdom for you. I'm assuming patience, understanding, all very important when it comes to this process, right?
I think the take-home message oftentimes is that there is a greater degree of enuresis or bedwetting in the general population than most parents would come to believe, because it's not a topic that comes up with any regularity, and it's not a question that is always the most popular. But it is a normal physiologic event, and you can imagine if 15% of children are having that problem at age 7, it's probably more the fact that we've set expectations that the child should be dry by a certain age. We're looking at the calendar, whereas the body is really paying attention to its point in development. The body doesn't say, well, I'm 7 years old, so I should be dry now. So part of it is just resetting our expectations, knowing that it's normal, and making sure that it's not something that becomes a stressor for the family or for the child, and a bit of patience.
All right, great words of advice. Unfortunately, that's all the time we have. We want to thank Dr. Gran today for joining us today on Speaking of Health.
Happy to be here. Thank you for having me.
And just a reminder for folks that Dr. Gran will be giving a free public presentation on this topic on Tuesday, November 30th at 7 p.m. in the main classroom at Fairmont Medical Center, and everyone is invited to attend. That's all we have today. Have a great day, everyone, and be healthy.